Hi, welcome back. My name is Kathy Brandon, and I'm with www.kathybrandonspeaks.com. And we are having our second video session with Dr. Michael Harris. Dr. Michael Harris is a hypnotherapist, and he is also a delightful, delightful practitioner who focuses in on eliminating bad thinking, bad behavior. Today we're going to discuss weight loss. We're going to discuss the lap band surgery. We're also going to discuss the Hypnoband alternative to the lap band surgery. And then in the last 5 minutes, we're going to have Michael give us a few takeaways so that we can start working on, the thinking and the behaviors that get in our way of success. And so welcome, Michael. Thank you so much for joining us again.
Hi, how are you doing?
Good. How was your Thanksgiving?
It was filled with turkey and all the goodies, but it's just the holidays, so
Nice,
it's
nice.
over now.
I know, right? Now, let's go ahead and let's get started. We do have a lot to cover today. And so I want to go ahead and ask
Okay.
a couple of initial questions. I know in our last video we talked a little bit about where, we want to cover a little bit of the history of hypnotherapy. And so I'd like to go ahead and give you the opportunity to kind of take us through a walk of where hypnotherapy started and kind of where we are now, because I want to give a fact to everyone right now. Hypnotherapy is deemed the quickest, most effective treatment of self-debilitating behaviors and thinking, weight loss, nail biting, smoking, fear of heights, self-sabotage, a fear of public speaking. And so that's one of the reasons that I wanted to bring Michael on for a 6-part series, is because I personally, and you'll hear this over and over through our video, is I personally experienced Michael's work. And so I want to introduce you to multiple people. Michael's one of the first who have really impacted my life, and I know we'll have the opportunity to impact yours. Michael, tell us a little bit about where hypnotherapy came from and where it's going and what it can do.
Hypnosis, it depends on how far back in history that you want to go. I mean, every primitive tribe has had their own healer or shaman in which that they access, the spirit world, or they access altered states of consciousness in order to facilitate. They do dream interpretation, they do healing, they do a wide variety of things, and that's kind of where hypnosis started, is that they use, I mean, this was an ongoing process that was part of our normal daily life, and having access to the unconscious resources that we have was just normal and natural. Okay, and then you enter the industrial age, and the more or less the age of conscious thought, and they pretty much reached the point where if you couldn't touch it, you couldn't measure it, you couldn't hold it in your hand, it wasn't real. And from that point forward, they started moving more towards the mechanics of medicine, of using surgery and using medications to facilitate healing. So much so that, if you watch TV at all, you'll see that we have digressed to the part where you see a commercial for vitamins on the TV set. They're saying, ask your doctor. Like you really need to ask your doctor if it's okay for you to take vitamins, or if it's okay for you to go for a walk. I mean, we've reached a point where we've become clones, and we no longer do our own thinking. And I think that hypnosis is a way to get people back in touch with their internal processes, their natural healing facilities, and get themselves back in communication with their body. In answer to your question about where hypnosis officially started, it started in England, and I completely forgot to pull up my research so I could have it right over here on my screen. But there were several English physicians in England during the period of the 1800s, prior to World War I. Actually, it was actually prior to the Civil War, in which one of the biggest problems that they had with wartime injuries wasn't the injury itself; it was infection, and it was also the surgery themselves. Is they didn't have a quick method of putting people into and the method that they used for anesthesia back then was ether, and you just couldn't take somebody in a war situation during a battle and put them and use ether and put them out. There wasn't enough time, and there wasn't enough ether. And what they wanted to do was come up with a methodology that they could quickly relax the person into a state where they could endure the pain of the surgery or the amputation. And that's basically how it began, is that they were looking for something to be more effective for medicine. And people have natural processes inside of them. If you've ever hit your thumb with a hammer, you know that it hurts really bad, initially, and then it kind of stops. And the reason that it kind of stops is that your body is producing drugs that deaden the pain. Well, those drugs are available to you whenever you need them. It's just a process of getting to them. And in the early 1800s, early 1900s, hypnosis was a lot more pervasive in the medical community as a method of helping the patient in surgery and doing non-medical surgeries, because during that time, ether was the only medication that they had, and the danger of giving somebody ether and them going to sleep and never wake up, it was very, very real. And I think that we talked about this as like a teaser. There were two brothers, you may have heard of them, called the Mayo Brothers. Mm-hmm. And they were surgeons, and they did 24,000 surgeries without a single ether-related death as a result of using what they changed the name from hypnosis prior to surgery, and they were able to reduce the amount of medications that they were given by as much as 3/4 of the normal dosage of ether. Now, the other thing that they noticed is that a person who has received medical hypnosis, the wound or the surgery site, it bleeds less, because the person is actually directing blood away from the wound while the surgeon is working on it, and then when they close the wound up, they can actually increase the blood flow, all of the neuroepinephrines and the dopamines that we naturally produce in our brain. And if you think about how medications actually work, medications go into your system. It activates the hypothalamus in our brain, and then the hypothalamus produces the drugs that actually that reduce your fever or remove aches and pains or reduce your pain. So hypnosis, to me, is a far more ecological and a far more practical way for people to handle their day-to-day activities of living. If you've got a little bit of tooth pain, you can sit down for a couple of minutes and do some breathing and think about your tooth becoming more numb, and that'll get you to the dentist, and you don't have to take meds. You don't need pain pills. There are plenty of people out there who that are actually allergic to anesthesia. So people hypnosis practitioners that are trained to do medical hypnoanesthesia or do medical hypnosis actually are brought in, and they work right with the physicians and the patients, teaching the person how to put themselves into a deep enough trance where they've actually performed heart surgery with somebody with no anesthesia. I've done yes.
Sorry about that. I don't mean to interrupt, but I do want to tease out one little thing. Is okay. So if doctors have been using, some people call it guided meditation. For this video, we're going to call it hypnotherapy because that's what I consider it. Okay, so talk to me about the Hypnoband therapy system, because it's just a natural progression. Like if people are considering the lap band procedure and they're a little nervous about surgery, they're a little nervous about like rearranging their stomach.
Maybe they can't have surgery.
Yeah, or they can't even have surgery, right?
I have a patient. I have a patient right now that was turned down for lap band surgery. He has to lose 300 pounds before they will consider him for the surgery. He's literally too heavy for surgery.
Oh, I didn't even know that was a possibility. Talk to me about that a little bit.
There are people out there, and I hate to use this term, but it's accurate. People who are morbidly obese, people who are so heavy that they can't walk, or that they are so heavy that they can't leave their home. And these people, it may sound crazy, but they are not candidates for traditional lap band and gastric band and gastric sleeve surgery, because it's too risky, and the doctors won't take the risk. The insurance companies won't take the risk. So they say, okay, we're going to put you on a diet, and then hopefully you'll lose enough weight, and if you live long enough, then we'll do the surgery.
Okay, let me just make sure that I understand this, because it just sounds kind of crazy to me, right? Okay, so say I'm, 300 or 400 pounds. I make this life-altering decision to get help. I go to the doctor, which just going to the doctor is a major ordeal because of my size. And then I get to the doctor, and they're like, oh, yeah, you got to get on a diet.
You have to live. And they would say, if you were like, okay, I know you're a little bitty, tiny girl, okay?
Right. Yeah.
Okay, so if you weighed 350 pounds, okay, your physical stature probably would not support that weight. So you would have knee problems, back problems, ankle problems, and all of these things. You may not even be able to walk unassisted. Okay.
Right.
And the medical community, I mean, this is a very litigious society. They're not going to put themselves in a position where there is any possibility of a lawsuit. So,
right. And I understand the lawsuit thing, Michael. I guess the thing that makes me, and I am one of those people that have a high metabolism, so I haven't had to personally deal with a lot of weight issues. But here's the thing that breaks my heart, and I guess that's why I really want people to know who you are and know the work is, okay, when you get to that point and you're ready to ask for help and you do everything that it takes to actually get out your front door, because in that kind of situation, just making the decision to get out your door is a big deal. And then you go to the doctor and they're like, oh yeah, go on a diet and then I can carve you up. I'm not saying anything bad about lap band. I don't have a problem with it. Where I'm at with is I'm frustrated by the fact that somebody makes a decision to get help. They go to the doctor, what their insurance will quote unquote cover, and they're told to do the same thing that they've been trying to do for the last 10 years. And so, I mean, okay, talk to us a little bit about the Hypnoband, and for that person that's at home, that person that just got told that by the doctor.
Okay. And I actually have two people now that I'm working with. One of them was told that they needed to lose about 300 pounds, and then the other one, and this guy's huge. This guy probably probably weighs 800 pounds. And then the other one was told that they would have to lose 100 pounds before they could qualify for the surgery because their blood pressure was too high, and the physician, obviously their surgeon was worried about the stress that putting somebody into an anesthesia, chemically. They put them into a state that is so deep that they literally have to breathe for you. They put tubes in you, and they literally take over your breathing. Okay, so you have a risk of fluid in the lungs. Okay, and that is a common side effect for anesthesia. Even for people who are very fit and very ambulatory, your lungs fill up with fluid. Yeah. So the very first 24, 48 hours when you're coming out of surgery, you're coughing up all of this liquid that accumulates in your lungs. Well, what if you're not ambulatory at all and you have health problems and stuff? It's dangerous. Okay, so talking about, so you want to talk about Hypnoband, what we do is not invasive at all. As a matter of fact, I'm working with a couple of people via Skype, kind of like what we're doing right now. And so they don't even have to come see me. As long as I can see what they're doing over the Skype thing, I can work with them and put them into a state where we make their stomach smaller.
Okay, so let me just bring that back in case anybody missed that. So, I mean, just like we're doing right now in a conversation over Google Hangout, you're doing it over Skype. You can literally, instead of somebody who makes that decision in their house, they can meet with you from where they are. Like, you literally go to where they are because the technology allows you to do that. You can literally go to where they are, start working with them, and get them to the point where, they can start that process of losing weight. They can start that process of shrinking their stomach. They can start the process of using their mind as the powerful tool it really is, instead of as something that's working against them. Is that accurate?
Yes, it is. And the other thing that you can do with...
Oh my gosh.
Well, the other thing that you can do with hypnosis can't do with anesthesia and a pocket knife is that you can't change. You can change the beliefs and the behaviors that got them there in the first place. And that was the thing that you said you wanted to talk about today.
And I do. I really want to get off on that. I want to talk about that. I wanted to go through the history and all the goodness that goes with that so that we can kind of get people to where they are. But, what I really want to talk about, and I could be selfish here, but on this point I don't care, is, let's talk about how, okay, technology is with us in a way that it never has been before. And so now, instead of people saying, oh yeah, I've got to find a hypnotherapist, I got to get out of my car, I got to go to the shop, I got to make all this time in my schedule, with technology, Michael, you're able to literally do this stuff just like we're talking right now. Now, that's never been available in the history of hypnotherapy at all.
No, it's been around for a little while, but yeah, I understand. It is a great innovation, and my client base now is the entire world. I have a client in China. I have a client in Riyadh. Right. And it's just, the only thing I have to do is like move my clock around, because I hate getting up at 2 in the morning to do a hypnosis session, but I'll do it.
Right. And
I did want to mention one last thing that to me is extremely important, that probably most people don't know, is up until about 1958, all hypnosis was performed by doctors.
Oh, interesting. I didn't know that.
The medical community had an absolute death grip on hypnosis And you would, if you got hypnosis, you would go to your physician that was hypnosis trained. And when the Korean War ended, the incidence of PTSD, because World War II had just ended, then they had the Korean War, and the psychiatry and psychological community was so overwhelmed that they had to open up hypnotherapy to the masses, and they allowed non-MD practitioners to begin practicing hypnosis. And ever since then, the AMA has been trying to get get a lock back on it, and it's just cat's out of the bag. It's never going to happen.
Now, I want to talk about that a little bit, because that's something that I hear from people a lot is, because you don't have to go to school for 16 years and you don't have to pass, your medical exam and that kind of thing, but you are really, truly impacting someone's health and their life and everything like that. Talk to me a little bit about how to determine what kind of hypnotherapist to look at, how to do your research, how to select.
Well, there's several good certification bodies out there. I would, if you were looking for a comp, and I don't want to say that one hypnotherapy or one hypnosis certification body is better than the other, but there are several out there that have been around for a while. The Erickson Society is one of them. The National Guild of Hypnosis, and the International Medical and Dental Hypnosis Association, and those are the three that I belong to. The Erickson Society, you have to have a minimum of a master's degree, a doctorate, or an MD in order to belong. So the presupposition is that the person that you meet that is an Ericksonian certified practitioner, that they have at least attended 4 to 6 years of college. So hopefully they absorbed a little bit.
Right.
But that's not that doesn't necessarily mean that the people aren't competent. I know lots of people that are in the NLP community and the neuro-linguistic programming portion of what hypnosis is. They have two major certification bodies, and you just flat have to get your training through those organizations, or you're just not recognized. And it's expensive, and it takes time. So that the people that are coming out of the Society of NLP, there's also a Society of NLP in England. And if you have those certifications, NLP California is a real good one, and also the University of California at San Jose actually has an NLP program that's run by a friend of mine named Robert Dills. So, I mean, if you have any of those certification, or if you're looking for a practitioner, look for those types of certification. NLP, they need to be National Guild of Hypnosis. You have to provide some fairly extensive information to them before they will accept you as a member. So, I mean, they were actually harder for me to join than the Erickson Society. Yeah, but what you're looking for is somebody, and it's almost, I almost hesitate to do this, is that you're looking for somebody who has a particular passion for what they do. And I know a couple of people that their entire world is surrounded seeing people. They want to help people stop smoking, and that is all they do. And it's a niche for them, and they're busy. I mean, you can make $100,000 a year, just helping people who want to stop smoking. There's that many people who wish to stop, and but that's not my forte. So if somebody comes in, I will work with them. but if I don't click with them, I'll refer them out. And I think that that's the other thing that would be very, very important is when you're interviewing hypnotists or hypnotherapists or NLP practitioners, if you don't, within 5 minutes, if you don't feel like you just located yet another long lost cousin, you need to find somebody else that you really, really click with, because you're going to have somebody who's going to be helping you delve deeply into your psyche, and you need to be able to trust them. Mm-hmm. And it's not that they can do anything to you, it's that you need to feel comfortable in that situation, because hypnosis is a deep process, and that's probably the reason that they say, on the CDs that you get, do not listen to this while listening in your car, because you just drive off the side of the road, because you're not local.
Right.
Okay. Getting back to the Hypnoband. I know it sounds really, really like it's this incredible procedure, but it's actually really simple. I mean, all I am doing is helping people access the autonomic parts of their brain, mm-hmm. the same ones that can lower your heart rate, the same ones that can lower your blood pressure, is the same ones that you can give it instruction to literally shrink the size of your stomach and to send a signal to your brain that you've had enough to eat. I mean, really, that is the bottom line. Is Americans, and this is pretty much a global problem, is we eat too much food and we move around too little.
Right.
Yeah, that's the bottom line. I know you're not like that, because every weekend I see you on Facebook that you're out playing frisbee golf. But I mean, right. the average
exercise girl at all. I literally play frisbee golf and do exercise because mm-hmm. I have had to learn that mm-hmm. Somebody needs exercise. Now, Michael, I want to talk a little bit about, I want to ask you some questions. Maybe you can talk to people a little bit about, hypnotherapy is really about giving you the ability to be in control of your mind and really, mm-hmm. No one questions the fact that we're not using all of our brains. Every right. individual human being knows that we're not using every bit of our brain. Mm-hmm. And so I want you to talk a little bit about and explain a little bit about how hypnotherapy, or at least my experience with hypnotherapy, and you made mention of it earlier, it really is about you tapping in to what's really right for you, as opposed to, like, as we grow up, we take on stuff. As we work for a company, we take on those habits. As we're in a marriage, mm-hmm. we take on that. There are so many things along life that we take on that we don't realize how far from ourselves we become. Mm-hmm. Can you talk a little bit about that, like with your patients and who you work with? And I'm one of your patients too, so feel free to talk about me if you want to. But, let's talk
about you all the time.
Minute. Yeah, I don't think we're all being honest about what we want, because we have all these pictures of what should be. And I don't want to go off on a lot of psychobabble, but let's talk about the nuts and bolts of what you do to take care of that, to address that.
Okay. One of the easiest ways to explain what you're talking about is that we have through technology. Okay, our technology is allowing you and I to talk right now. I'm in my office, you're in your office, and we didn't have to drive to meet with each other. But that's fantastic. Yeah. Okay. That is one of the fun parts about technology. The downside of technology is that humans, as a group, humans are pretty lazy. Okay, we no longer grow our own food. We no longer we don't go fish. We don't go pick berries. We don't walk to where we go. So we pretty much our body is designed as this incredible locomotion machine, and every single thing that we do has a purpose. And one of the most important purposes that we have is that we have this nifty little system called the lymphatic system. Okay, and most people don't know one single solitary thing about their lymphatic system, so I'll just keep it really simple.
Okay.
Our lymphatic system is responsible for removing all of the toxins out of and all of the dead cells out of our body. Okay?
Mm-hmm.
And if our lymphatic system shut down for 24 hours, you'd be dead. That's how important this system is. Okay? Now, what's really curious to me is that our lymphatic system, which is very, very similar to our circulatory system, does not have a pump. We have a pump for our circulatory system called the heart. Our lymphatic system is managed by our breathing and by our physical activity. And you're going to hear me coming back to this over and over again about our physical activity. I would say that we are more closely related to sharks than we are to primates, because as humans, we really need to keep moving. We need to keep swimming. We just need to keep our bodies moving, and we need to walk, and we need to stretch, and we need to reach up, we need to bend over, and we need to exercise in order to keep our lymphatic system clean and clear. Okay? If you get to people who are extremely obese, okay, and the medical community defines anybody who is 25% over fat. Okay, so if your body fat is, if you're a male human and your body fat is 35, or if it is 25% or more, you are considered obese.
That's it.
If you are more than 100 pounds overweight, you are considered morbidly obese. Okay, and
everybody in the
this
world
is
is overweight, Michael.
I'm sorry?
I said everybody in the world is overweight.
8 out of 10 people.
Yeah.
Yeah. Okay. So my point would be is that for every 10 pounds that you are overweight, you're shortening your lifespan.
Right.
Okay. And we were just talking about the lymphatic system, about how important it is for you to move around. Think about, do you have cats?
No.
Okay, I have 2 cats, and I buy cat litter in 25-pound containers. Okay, so if you think about picking up a 25-pound cat litter container and carrying it around with you all day, every day. You go to the bathroom, you take it with you. You go outside, you want to take your kid for a walk. You want to go dancing, you want to do anything. You go to the grocery store, you got that 25-pound cat litter container with you.
Right.
How long would you carry it around till you wanted to get rid of it? Okay. What if you can't?
Right.
Okay. So that's one of the things that I think about in terms of, yeah, people look better when they're thinner and they feel better when they think. But my main concern, my chief concern, is that I help them eliminate the excess body fat on them so that they can actually move around more, so that they can self-maintain. Okay, and doing something simple like getting up and going for a 20-minute walk with your spousal unit, and getting away from the TV and getting away from your cell phone and just getting away from all of the electronics.
Mm-hmm.
Just 20 minutes.
Right.
Just something simple. Okay. So you wanted to talk about behaviors. The way that our mind is actually organized, our brain is organized to solve problems.
Mm-hmm.
Okay. And the other thing that I absolutely want people to get as a takeaway on this conversation is every single solitary crazy behavior that humans do at one time or another had a positive intention. Okay, so somebody who much,
mm-hmm.
okay, their behavior may not be working for them in the present, but when that behavior was created, It had a positive intention. They wanted to fit in because all their friends were drinking, okay? Or they wanted to be more grown up because their parents drank. Or maybe their home life was so crazy that they wanted to take an overnight vacation and they'd go out and drink and forget about life for a while, but when they woke up, you know, not only was their life back, but plus they had a big headache. Okay, so whatever behaviors or habits that we develop, they all have this positive intention. My question that I generally ask when I have somebody in my room, we're talking on Skype, is how's it going? You know, how's that working now? And
right,
you know, if we can talk to the part of them that created the strategy, okay, and find out what the original intention was. Well, maybe they've grown up, or maybe technology has changed, or maybe they've changed jobs, or maybe they're no longer married to that schmuck that they were married to, and this behavior that they're exhibiting is no longer necessary.
right.
And one of the things, since we're talking about Hypnoband, is if I have somebody come into my office that is suddenly, inexplicably put on 15, 20, 30 pounds, the very first question I'm going to ask them is, what's going on in your relationship?
Now, why would you
Because
ask
if
that
you
question?
think about... I'm sorry?
I said, why would you ask that question specifically? Out of all the questions you can ask, why would you make that tie as opposed to saying, do you hate your job? Right?
That would probably be my second question. Okay, but if you think about, okay, the way that I approach what I do is that I think about every single thing that that people do as a metaphor. Okay, so if somebody is suddenly, inexplicably putting on a lot of weight, what are they protecting themselves from?
Now explain that a little bit. Why would you ask that question that way? Like somebody who puts on weight, like, you know, it's just Thanksgiving, right? And Halloween was before that, so you know, I ate too many Reese's peanut butter cups on Halloween, and then I ate too much pie on Thanksgiving, and lo and behold, I have an extra 10 pounds. Why would you go to the place of, why do I have to protect myself? I know where you're going. I just want
well, people don't come see me for 10 pounds.
Right.
They go to the gym.
Right.
Okay.
But, you know,
I'm talking about somebody who has gained. Let's say that you have somebody who. Here's a typical example. You got a man and a woman, and they meet. And they do all this fun stuff, okay? They go dancing, and her new beau writes her poetry and brings her flowers and do all this other stuff. What happens next? You know, they get into a relationship, they get married, okay? They have babies. Now they have babies. They have a mortgage, and they do all of those nifty things, okay? What happens to the dancing and the flowers and the poetry and the long walks and staying up all night just to watch the sunrise?
Right.
Okay.
Right.
So people gaining weight. You know, when I ask people what's going on in your relationship, it doesn't necessarily mean, you know, oh, my husband's having an affair and I just found out about it. It could be something really subtle, like. They're not wooing one another. I think one of the things every February I teach a thing called sensory styles, and what I essentially do is I teach married couples and committed couples how to flirt, because of all the people on the planet, permission to flirt and should be flirting just, you know, like flat out, just really raunchy flirting. Who do you have permission to do with that more than your spouse? Okay, and who is least likely to flirt with you is your spouse. So
Yeah, that doesn't seem to make much sense.
yeah, well, no,
Yeah. Yeah.
right. Okay, so my point is that people, somebody might, if somebody puts on 20, 30 pounds right away, I'm going to ask what's going on with their relationship. I may ask them what's going on at work. The next question that I would ask them is someone in your family very ill? Are you a permanent caregiver of a terminal patient? Has somebody recently died? There are lots and lots of things that can cause sudden weight loss, sudden weight gain, and sudden weight loss. If you have somebody who has been married for 20 years and they stopped dancing and, now they have kids, now they stay home.
Right.
So they get home from work and they eat dinner and they watch Dancing with the Stars until they go to bed. Okay? Right. If you put on, okay, you were using Thanksgiving as an example, okay? It is entirely possible for somebody to gain 5 pounds.
Oh, sure.
Over Thanksgiving. Sure. Because they're doing nothing, okay, but eating. So your body, you eat all those calories, blah, blah, blah. Let's say you gain a couple pounds, okay? Now, multiply that times 20 years.
Right.
Right, okay? So if you've got somebody who has gained 10 pounds per year for 10 years, how overweight are they?
A lot.
Okay, if you get somebody who's gained 10 pounds over every year, over 20 years, how overweight are they?
Wow. That's just
okay. So we're not talking, in hypnosis, yes, you can do some incredible, wonderful things with hypnosis. But I think that part of the problem that we have is that people are looking for some major league, life-changing, super whatever it is, when it could be something simple, like I'm talking to a guy and he goes, my wife and I used to do all that other stuff, and the very first thing that I ask him is, do you date? And he's like, no, I'm married. I'm like, you should be dating your wife. When do you guys go out? Does your wife like to dance? He goes, yeah, she loves to dance. I hate it. I go, you knew she loved dancing when you married her. Guess what? you get to learn how to love dancing again. Right. Okay? So that might actually be a behavioral change thing that he and I might actually do, because he may have an event happened in high school that somebody laughed at him that he didn't know how to dance, so he's never liked dancing. And that's something that you could reach in and you could just pull that right out, and now it's okay for him to go dancing, and his wife's going to dig it.
Right.
Dig it. Right. Okay? So hypnosis isn't always about removing things. Sometimes it's about adding more tools to your toolbox. I had a client one time who part of her job is public speaking. Mm-hmm. That's how they get clients, is they do public speaking, and they do them at these large things, and she can do it. She has the capability of doing it. She just hated it. Mm-hmm. So she came in, and I just had her go into a really light trance. And what I did is I had her imagine that she was going to go publicly speak at some event, and she saw herself up on stage, and she immediately started doing the whole nervous, and her breathing changed, and saying, like, hold on a second, this is completely different. And one of the things that I know about this lady is she absolutely loves dogs. That's 3 of them, okay? Because she didn't have any kids, so she has fur babies. Okay.
Right.
All right. So I said, this is going to be a different conversation. You're going to go give your speech into this room full of dogs, and every chair out there is going to have a dog in it. Okay.
Yeah.
And the dog that makes the best eye contact with you gets to go home with you.
Nice.
She's never had any trouble with public. She's now speaking nationally. Mm-hmm. Because every time she goes in, the last thing she does before she goes on stage is that she imagines the audience is a room full of happy dogs that all want, a a home. And let me tell you, if you believe in reincarnation, the best thing that could ever happen to you is for you to be one of her pets.
Right.
Because they have a great life. Okay. So, I mean, it's like, this is kind of what I'm interested in. To me, the Hypnoband portion of it, I hope I'm not disappointing you, but that's the easy part. Right. That's the really, really easy part. The part that's interesting, complicated, kind of a Rubik's Cube part of it is the behavioral and lifestyle modification portion of it, in which the people are coming to you and they say, I want to do this. Right. And I'm going, okay, we're going to do that. But I also want them to recognize that they're going to be changing their identity. When they get done, they're no longer, their identity is no longer, I am a fat person. Right. Okay, their identity is going to be something completely different. And one of the things that is curious about our society is you can be a fall down drunk and you know, everything's just fine. Everybody knows you're a fall down drunk and everything's just fine. If that person goes to rehab and then comes back out and their behavior are completely different, what generally happens in their family? What generally happens to their social and their friend groups? All those people go away. So that is one of the things that I want to prep people for, is that when you start changing your behavior, and let's say that you're married, and you know, this is an extreme example, of course, but let's say that every single Sunday you and your husband go have a chocolate sundae at, you know, XYZ ice cream shop. Okay, well, if you don't plan for that behavior and then substitute it of, okay, well, now you're not going to XYZ chocolate shop, it's not okay for you to take that out. It's okay for you to take it out of your life. It's not okay for you to take it out of your spouse's life. So one of two things need to happen. Either you need to be okay with them having a chocolate sundae and you having a glass of water, a cup of coffee, or something that is lower calorie, or you guys need to chat about it and come up with a new activity or a new something that is equal to or better than the current activity. And that is really, really important, because if the behavior is not equal to or better than, why change? Right. Exactly. You know, yeah. Like, I have this great car, and you're gonna trade me a car, okay, that is 10 years older, it's rusty, it's got a flat tire, but it's a great deal. No, it's not. That makes sense? Yes, it makes perfect sense. Okay. Now, we do have to start wrapping up, Michael, so go ahead and let people know how to get in touch with you. We've gone ahead and put your phone number down there. And can you give us your website and tell us a few of the little things going on? We have this week in November, and then December starts. Last time that we talked, I was doing a hypnosis for food thing, and I am completely booked. I have no more appointments left in November. On the first time it's ever happened is I'm completely booked before the month ended. Congratulations. Thank you. And starting now until the 31st of December, Hypnoband. If you go to hypnobandtexas.com, I'm offering the Hypnoband at 50% off of the normal retail price. Oh, and I'm going to be doing. So the regular price is $9.97, and I'm doing it for the month, so for the Christmas season, so that you can give the gifts of health for Christmas is $9.97, and they just go to hypnobandtexas.com. And I absolutely cannot remember my name, my phone number on my website, but I'll give you my cell number. You can call me. It's 214-789-7490. And if they want to send me an email, they can send an email to drm@hypnoband.com. at drmichaelharris.com.
Awesome. Awesome.
So,
And thank you so much for taking the time, Michael. I know we ran a little bit over. We're trying to keep these between 20 and 30 minutes. We did run over a little bit today, but I definitely think the material was so worth it.
thank you.
I just appreciate you making yourself available. I know your time is very valuable, and so thank you for allowing me to interview you. And I'm looking
Are you
forward to
kidding?
what's
I
next.
love talking about me.
I know, right?
Yeah, it's what I tell everybody. It's like I love the sound of my voice, and I believe everything I say. So yeah, let's do this some more.
And you know what? We have 4 more sessions that we're going to talk about. Our next session,
Cool.
we're just going to spend a little time on the Hypnoband. What we're really going to talk about our next week, and I'm really excited because this is kind of the Barbara Walters type interview that we're going to do, is I want to talk more about you being a business owner, Michael. I want you to share
Okay.
some of the successes and some of the behavior changes you've had to implement in your own life so that you can see the rocket success that you're experiencing now. And so I want to
Okay.
really go into that and give people some really juicy stuff next week.
Okay.
Okay?
Okay.
And I'm going to flash
Your answers are the answer is probably going to be the people who are going to be listening to this are probably going to be surprised at what I tell them is my secret for business.
You know, Michael, honestly, I really do think they will. That's why I want to go into this, because I love the way that you have lived your life and built your success every step of the way. I think you are truly the American dream. And so I want people to understand from your experience that, you know, it's not a fluke. Anybody can do this. And so you're an example of that. I am flashing Michael's number up there again. If you do want to get in touch with him, you can call his mobile number, 214-789-7490. His name is Michael Harris. You can find him at www.drmichaelharris.com, or look at the bottom of the screen. You'll see another website for the the Hypnoband. I'm sorry, Michael. So please reach out to Michael, and we will catch up with you guys next time. Thank you again, Michael. Bye-bye.
You're welcome. Thank you. Bye-bye.